Hi, everyone. Thank you for joining us for this program overview. I have the privilege of being joined by Miss Courtney Jadidian. Welcome, Miss Jadidian.
Thank you for
Thank
having
you for
me.
joining us. We're going to be talking about the Radiologic Technology program, which Ms. Jadidian is the department chair over today. So let's jump right into our questions. How many semesters is your program?
Sure. So the Radiologic Technology program is an associate degree program that is 6 full semesters. So our program starts in the summer semester and it's 2 full years. So summer, fall, spring, and students graduate in May.
Oh, fantastic. Just 2 years and they can enter the workforce after that.
Yep.
And with this being a waitlist limited enrollment program, how long does it take students to get those prerequisites, would you say, to be able to qualify?
Sure. So the prerequisites sort of range depending on how full-time you're, coming to school for those prerequisite courses. But most students are able to accomplish them in a year or so, depending on, like I said, how full-time you want to take those classes. But the wait list for our program currently is approximately 2 years of a waiting period. That fluctuates slightly, but we take 25 students into our program each year.
Fantastic. Thank you. And once students are ready to enter the field as a radiologic tech, what employers do you see them going to?
Sure. So in our Tri-County area, we have 4 main hospitals that we see a lot of students get jobs in after they graduate. That would be MUSC Health Lancaster Medical Center, MUSC Health Chester Medical Center, Piedmont Medical Center here in Rock Hill, and Piedmont Medical Center Fort Mill. So those 4 hospitals tend to be, like I said, the most common location that students work. But if the hospital is not your cup of tea and you like the sort of outpatient setting, a lot of students work in urgent cares, outpatient imaging centers, doctors' offices, or even do mobile radiography. So there's lots of varieties of job opportunities out in the workforce. And thankfully, we have a 100% job placement rate in our program and have for the last 10 years. So every student is graduating and getting a job after the program, which is great news. There's definitely a high demand in our area.
Oh, that is fantastic news. Congratulations to you and the students. What can students kind of expect to make when they're starting out in this field?
Sure. So in healthcare, there's a lot of variation in hourly rate, but a standard or sort of median hourly rate in our area working in the hospital is around $23 an hour for most students. Now, there's a lot of fluctuations in that depending on if you work second shift or third shift overnights or on the weekends. That definitely can fluctuate and increase pay significantly. After graduating the program, students sit for what we call the registry exam to become radiologic technologists, but you can do and seek additional certifications as a radiologic technologist in what we call advanced modalities like CT and MRI, radiation therapy, nuclear medicine. So those, what we call advanced modalities, can really significantly increase your hourly pay as a radiologic technologist.
Awesome. And do those like take a lot of extra time to get, or like is it an
So
additional 2 years or just a semester?
So most of those are on-the-job training that you would do, sort of continuing education on your own, and most employers will pay for you to get those additional certifications. Some have programs. So MRI, for example, is an additional 1 year program that you can do. We don't offer that here at York Tech, but that is an option, as well as nuclear medicine is another 1 year program.
Okay, awesome. What type of person do you think really thrives in this field and should consider it if they're looking to change their major, or figuring out what they want to do?
Sure. So if you have an interest in healthcare, this is definitely a good route to go. A radiologic technologist is someone who, cares for patients in the same way that a nurse would. So sometimes we'll get students and they'll be like, I don't want to go into nursing because I don't want to touch people, or I don't want to, be by sick people. Well, radiologic technologists touch people and are by sick people often. So, it is definitely in the same way a nurse is very hands-on with their patient, radiologic technologists are as well. We don't just sit behind a computer all day like maybe you've seen on TV. So that's one thing that's very important to consider. So you enjoy taking care of patients and really want to make a difference in their healthcare and diagnosis. I think that's important. Students who have a strong background in math and science do best in our program. There's a lot of physics in our program, as well as, math conversions, that sort of thing that we do. Some students don't realize how much we really go into depth with the physics. So it's kind of a good combination of the sort of engineering physics side, as well as the science side of our program. So yeah, it's kind of dual-sided there.
Learned something new today. I had no idea that that was a main component, but it totally makes sense now that you said it. If someone is considering this field and hasn't totally made up their mind yet, what advice would you have for them as they're thinking through this option?
Yeah, so advice for students would be, I think it's important to sort of know what you're getting yourself into prior to starting the program. There's lots of resources online and videos about, day in the life of a Rad Tech, that sort of thing. I think prior to, choosing this major, it would be a great idea to meet with myself or another faculty member to really talk through, what the profession looks like and what you would need to do as far as advising to start the program. And we can really talk you through the prerequisite courses that you might need, or, the job skills that you might need, that sort of thing. So I think the biggest advice is just feel free to reach out to one of us faculty, and we're happy to help answer any questions you have.
And I can second that. They are definitely super helpful and responsive, so don't hesitate to reach out. For those students, while they're on the waiting list, and having that 1 to 2 year wait there, is there any advice of like what skills they can be developing, or what careers would be good for them in the meantime?
Yeah, absolutely. So a lot of students during that waiting period will seek additional certifications here at York Tech. We have a lot of students who go through the medical assisting program, which is short, nice and simple, and give you a lot of the nursing style skills that you'll need once you're a radiologic technologist. So getting some experience in healthcare would be fantastic prior to starting the program, but is not necessary. I think one of the biggest skills a student can have coming into our program is just to be communicative, right? So sometimes even working as a server or bartender, something like that. We see a lot of students who, the ability to communicate with a stranger is important in healthcare, and not be shy and afraid to do that. So, having those kind of people skills is important. But the MA program is really common for students to do. We also have a great phlebotomy program now at the college, and that's an awesome opportunity for students to do prior to starting our program. Because phlebotomy, starting IVs, is the part of a role of a radiologic technologist. So having those skills would be super important prior to the program.
Awesome. Thank you.
Mhm.
Now, when someone gets into this field, what does their typical day look like?
Sure. So there's a lot of variety, sort of depending on what you're doing. So I'll kind of speak to the hospital radiologic technologist, since that tends to be the most common employment route that students take after they graduate. Day in the life of a hospital rad tech. So in the hospital, we're taking x-rays, right? So you might think most of the job is just x-raying patients maybe who come through the ER and they've broken a bone, right? That would be the most common scenario you may consider a rad tech doing. Well, there's a lot more to it. We definitely do work in the ER, but we're taking x-rays of the whole entire body, right? Chest, abdomen, pelvis, extremities, head work, all of those things we do. Also in the hospital, the radiologic technologist might work in fluoroscopy. So fluoroscopy is where the patient It's essentially live video x-ray. So the patient would drink contrast agent like barium or iodinated contrast, and we would watch their GI system. So see how they're swallowing, see how their GI system is working. So fluoroscopy is also part of the job. Also in a hospital, you might be pulled into the operating room, which you might not think as a role of the x-ray tech, but in the operating room, we use a piece of equipment called a C-arm, which also uses that live video x-ray. So we'll come into the operating room while they're doing surgery on, usually it's orthopedic surgeries like a hip or a knee replacement. And we'll bring in our video x-ray and take x-rays while the surgeon is doing their job. So, we get to see a lot of that stuff that maybe the surge tech gets to see as well. So we're involved in that area as well. And kind of the last component to a hospital job would be doing portable x-rays. So we take a machine up into the patient's bedroom or into the ICU, and we'll be taking the chest or abdomen radiographs there. So that's what I really love about the job is you're kind of a little bit of everywhere in the hospital and not really tied into just the imaging department.
That sounds super exciting. So if someone likes a little variety in their day, they would definitely thrive in this field, it sounds like.
Absolutely.
Awesome. Well, this is my last question for you today. Just any additional feedback or guidance that you'd like to share?
Yeah, like I said, please always feel free to reach out. That's a very important part of advising for students who are interested. One question that does come up quite a bit when we advise students is if our program includes sonography or ultrasound. Um, Unfortunately, we don't have a sonography or ultrasound program here at the college. Although it is medical imaging, the field of radiologic technology and sonography are sort of two completely different tracks. So you do not first have to be a radiologic technologist to then be a sonographer, and vice versa for a sonographer. So if your ultimate goal is ultrasound, there are programs out there, geared specifically towards that. What I always tell advisees though is I feel that getting your associate's degree in radiologic technology does give you more avenues to explore within healthcare. You can go on to get your bachelor's degree and go into teaching like myself. And then you can also seek additional certifications in those advanced modalities that I mentioned in CT and MRI and nuclear medicine and radiation therapy. So I feel a lot of people who choose radiologic technology find that there's longevity in the career because, if you want to change your career, it's not that difficult. You can go into a different, seek lots of different avenues to, stay interested in your career and job and seek advancement in your profession.
Oh, fantastic. We definitely get that question a lot, so I really appreciate that extra insight and guidance.
Absolutely.
Well, we really appreciate your time today and all the wonderful information that you've shared. As Ms. Jadidian said, you can go see her or another member of the Rad Tech department for questions. But if you do want to explore this career or need help getting connected to them or to change your major, feel free to come see us in the Advising Center. We are located in the Learning Commons, so you can stop by anytime. We take walk-in appointments or call or email us. Have a fantastic day and appreciate your time, Ms. Jadidian.
Thank you.